The views and opinions expressed in the following program do not necessarily reflect the policies and the position of Now You Know.
Good evening and welcome to Viewpoint. Together with experts and newsmakers, we make sense of the week's biggest issues and stories. I'm Barnaby Lo. In tonight's conversation.
Finally, the Philippines is rolling out its COVID-19 vaccination program. The only country in Southeast Asia that hasn't legally vaccinated a single citizen is expected to receive 600,000 doses of Sinovac's vaccine CoronaVac from the Chinese government on Sunday. The Chinese vaccine has obtained emergency use authorization from the Food and Drug Administration, but healthcare workers are wary and reluctant to get themselves inoculated with it. Local vaccine experts did endorse CoronaVac for medical workers, but the FDA's own limited approval came with a caveat. It was not recommending the vaccine for health workers. The confusion adds to existing vaccine hesitancy issues. It is unclear at this point who will be getting the first CoronaVac jabs.
And joining us for a discussion on next week's COVID-19 vaccination rollout here in the Philippines are Dr. Nisperos, who is a physician from the University of the Philippines College of Medicine, and he is also co-founder of Second Opinion PH, which is an independent group of public health workers and medical practitioners. Good evening, Dr. Jean. Welcome to the program.
Hi. Hi, good evening, Barnes. Thank you for having me here in Viewpoint.
Thank you. And also here with us is the co-convenor of Coalition for People's Right to Health. And of course, he is also a medical doctor, Dr. Josh San Pedro. Dr. Josh, good evening. Welcome to the program.
Good evening. Good evening, Barnaby, and good evening as well to Dr. Nisperos, who will be joining us today.
Okay.
Hey, Josh.
Now, just
hey,
to add to the video package that everyone saw just a minute ago, there is breaking news that the country will be receiving 525,600 doses of the AstraZeneca vaccine from COVAX, from WHO's COVAX facility on Monday. So Sunday, it will be Sinovac, 600,000 doses. And then sa Lunes naman po ay, sabi nila, pwede raw kantahin, 525,600 doses.
Yes. Wala akong tono kaya hindi ko makakanta yan.
ang bilis ng mga Pilipino talaga pagdating sa ganyan.
Yep, that's right.
Pwede daw kantahin, 525,600 doses. Ayan. All right, okay. So since that is the breaking news, let me ask both of you, does that solve all the confusion and the doubts and the reluctance coming from our health workers from getting vaccinated next week? Yung AstraZeneca, the arrival of AstraZeneca doses. Siguro let's start with Doc Jean.
Oh, okay. Akala ko, mas bata, mas una. All right. Well, the confusion just doesn't stem from the fact that there's a problem with the supply of vaccines. The main confusion actually stems from the fact that there's a dearth of data with one particular brand. And apparently that lack of data, while has been used by regulatory agencies to give particular recommendations, is not enough for a lot of health professionals and a lot of health workers. They want to see for themselves if that data is rigorous, and that's where it's all started. And that has always been the case. It's not insofar as nauna to, nauna yan. Kaya lang, even if this is the vaccine that's going to be offered to our health workers, they still want to have the chance to look at the data pertinent to it. And then for me, whether or not this AstraZeneca supply is coming in, it's tangential to the issue of transparency as far as the data is concerned of this particular brand, of the one of Sinovac, for instance. That's always been the issue, and that's always been the discussion amongst the health and medical circles. Is there sufficient data as compared to the other vaccines that are out there?
Pero ibig sabihin, may choice na next week.
There's always been a choice. There's always been a choice. And
yeah, go ahead, Doc G. Yeah.
Pero kasi yung gobyerno iba-iba sinasabi niya, 'di ba? Sabi niya darating yung Pfizer, sa COVAX facility, tapos hindi pala dumating. Tapos sabi niya darating yung Sinovac donation, tapos darating pala. Tapos ngayon biglang darating yung AstraZeneca. Pero nung sa issue nung Sinovac at nung ino-offer yan sa mga government COVID referral hospitals, meron pang linya na lumalabas na kunin nyo na to kasi hindi pa natin alam kailan darating yung susunod. So, even amongst government officials, kahit yung mismong kinatawan ng tagapagsalita ng gobyerno, hindi consistent yung sinasabi. Nagbabago-bago. So, magtataka ka. No? Kahit naman doon sa simulat sa pool, nung pinag-aaralan pa, kung tinitignan natin, if we look at the government regulatory agencies, for instance, yung FDA, nung pinag-uusapan pa anong bakuna yung papasok dito, malinaw yung may mga datos and why they are being accepted here and why dapat natin silang bigyan ng EUA. Pero bakit laging sinasama tong particular na bakunang wala namang datos, walang pinapakita sa atin? So, may pagtataka na doon. So, may bahid na ng politika doon pa lang. So, it's always been that. Now, nung nangyari ang issue na wala naman palang ipapalit, mauuna pala to, lalong nag-anak ng, nag-create ng problems and mistrust because, well, even the way it was delivered, if you were an employee of the Philippine General Hospital and you only learned about it through the news, na hindi mo lamang narinig mismo sa administrator nyo, tapos narinig mo lang sa news, may parang, teka muna, something's wrong there, di ba? Iisipin mo, bakit hindi mo na sa amin sinabi? Dahil the whole time na pre-register yung mga tao doon, iba ang pinag-uusapan, iba yung nasa conversation. Tapos biglang, eto, sa news mo pa maririnig. So all of those, nakadagdag yun Hindi siya nakadagdag sa paglilinaw. Nagkadagdag siya doon sa nakulayan ng past nung Sinovac na why is it being supported even with the absence of data. And now lalo pa ngayon parang may hard sell You can't help but feel hindi mo maiwasang maramdaman na may push behind it. I mean, it might sound like a conspiracy theorist, pero hindi mo siya maiwasan dahil nga yung confluence, yung pagkakasunod-sunod ng mga pangyayari, ganun siya dumating.
Doc Josh, obviously, si Doc Jean, he's from PGH, so I think he might be, correct me if I'm wrong, Doc Jean, but he might be specifically talking about the healthcare workers at the PGH. In a wider sense, yung mga health workers natin na hindi taga PGH and working elsewhere, we have a lot of healthcare workers here in the Philippines. Do they feel the same?
Yeah, pretty much you mentioned earlier, diba? So it's 525,600 yung sa AstraZeneca, no? So the question is, how do you measure? Now, how do you measure the vaccine confidence? So how do you measure it, especially with regards to health workers? Is it the doses? Is it the data? Or is it really how health workers feel that they are included, and then how they feel that they are being consulted and how they feel that they are being appreciated, no? Especially in the middle of this vaccine rollout, no? Especially since we've heard a lot of conflicting information. Diba? First, they were saying that a certain vaccine is not available for health workers. I mean, it's not suggested, no, for health workers. Yeah. And then all of a sudden, we hear na, no, hindi, okay lang naman, pwede rin naman pala. No? So, how do health workers feel with that? No? Especially, you hear other positions like we can trade our own health workers for more vaccines. No? So, how does it reflect on how the Philippine health system appreciates its health workers, no? Its frontliners in the middle of this pandemic. So with regards to the coming vaccines, no, it really has to beg the question, how will we really measure that confidence? No, it's not just a matter of a yes and a no. So that's something that we saw in PGH, for example, no, that in a lot of health workers, they would ask, do people want to be vaccinated? No, and that's something that the Okta research also tried to do when they ask people and the average person, are you willing to be vaccinated? No, but more often than not, it's not as simple as a yes or a no. No,
Sure, no.
there are a lot of factors, especially that we're not just talking about hesitancy, no, between acceptance and rejection of vaccines, but more of an anxiety that we see people having uncertainty, and at the same time, you also have trauma, from the previous vaccination efforts that have happened in our country, and then people are not sure or not reassured on whether there is really evidence. There's no reassurance of whether a health system will really respond to kung magkakaroon man ng side effects, for example, no, and will health workers be able to work normally during this time? Of course, wearing the personal protective equipment, but when they go home to their families, do they have to think about, I only have 50% protection, I only have a certain amount of percentage based on whatever efficacy data that I hear coming from the experts, no? So there has to be really a reassurance of a lot of the health workers on especially on clear data, and especially as proper reassurance, so that they can do their work properly, they can live normally, and go back home to their families after their long duties with COVID-19 patients.
There's a lot to unpack dun sa sinabi mo, Doc Josh, pati na rin sa mga sinabi mo, Doc Jean, kanina. So, himayin natin, ano? First of all, I'd like to ask, shouldn't we trust our experts? So, yesterday, our experts spoke. These are our local vaccine experts. And they said, we recommend Sinovac for our healthcare workers. Shouldn't we trust them? Sige po.
Go ahead, Josh.
Okay.
No, go ahead,
Well,
Josh.
well, the thing is, yes, they did speak that, no, the NITAG did say that they did recommend, no, but at the same time, we also heard other experts, a regulatory agency at that part, no, so the Food and Drug Administration, a major regulatory agency of all food and all drug, all cosmetics in the country, they're the ones who mentioned that yes, it is efficacious, yes, it is safe, but for health workers, we don't recommend it. And then all of a sudden, another group of experts, a technical advisory group, a recently formed technical advisory group, while we're not we're questioning their credentials, it's just, for a lot of people, there is that disconnect. Why all of a sudden is there another agency contradicting a major regulatory agency? And they're basing apparently on the same data, which is unfortunately not also available to the wider public. That's something that we didn't see with the other vaccines. No, like when we granted an emergency use authorization for Pfizer, for AstraZeneca, this wasn't really put into question because the data was widely available, because the data was accessible for the average person to see online. No, and at the same time, a lot of medical societies were able to post the information, and a lot of organizations were able to bring down the data to the communities. But the problem with Sinovac is not really where the vaccine is coming from or who created the vaccine, but rather where is the information that we would be able to provide, especially the reassurance that patients need, to translate these information to provide the proper assurance that is very much needed by the larger population, regardless of whether you're a medical professional or not. No? The same reassurance pa rin stands, na kailangan pa rin mapakita natin ano yung possible side effects. No? What is the chance of us getting a COVID-19 infection? What is the chance of us getting a severe COVID-19 infection? While we keep hearing that there is 100% protection, but if we don't see the evidence that really shows this, so we can tell the people based on our own analysis of the data, how is that different from us just following barely something that we have not validated on our own.
Doc Jean, I think you agree
Yeah,
with Doc Josh here.
Well,
Yung
yeah.
lack of transparency, that's your problem. Lack of data,
Well-
lack of transparency, that's your problem with Sinovac.
Well, not only that, but back to your question of whether it's important for us to trust the experts. It's not just a matter of trust, actually. right? Even though we have put in place gatekeeping or regulatory processes, it doesn't necessarily negate the fact that we have to participate in the conversation. And for me, if you're looking at the bigger picture of trying to solve vaccine hesitancy and restoring confidence in vaccines, you can't just give it to the hands of experts and say, look, believe the experts, they know better, and they can decide on our behalf and weigh all this data. The important aspect of any public health measure, and immunization is a public health measure, is getting people involved, getting the ordinary people, everybody involved. And in this conversation, the narrative is just focusing on a few experts just deciding on our behalf. It shouldn't be that way. I think the experts should put it in terms that are understandable for everyone. As Joshua said, if the data is out there already and people are willing and can easily access it, then there's no problem. But if the data is not out there, the role of these experts is to explain to us and to show us
Pero,
the data when we ask
pero
them. So yeah, kasi the problem with the narrative that let's put it in the hands of the experts is that's always been the narrative of our anti-pandemic response. It's always like, trust us, we're going to do this for you, and we've seen it. This is just another permutation of that. Sumunod na lang kayo. It's totally disempowering. If you want to have a vaccination program to succeed, you get to have people involved. You can't just rely on experts to solve your vaccine hesitancy. You need to have ordinary people talking about it. Right? You need to have your people in the communities talking about it and learning about it.
Pero hindi ba may data? Hindi ba may data itong Sinovac? Because where would the FDA base its emergency use, its granting of the emergency use authorization? Where would these experts base their recommendation if there is no data?
Yung data kasi nanggagaling mismo dun sa maker, dun sa Sinovac mismo. So the data on their vaccine comes from Sinovac itself. That's great, but we should just rely on that because they're the ones making it. They're not going to give us all the data that we need, and that data has to be vetted, peer-reviewed, looked on by other. Kaya yung iba, like yung ibang vaccines, meron na kasi silang published data. No, yung mga data nila na nilabas na i-publish na. Doon sa proseso ng publishing, meron na siyang vetting process din. So napi-peer-reviewed din siya, nakikita kung rigorous yung statistics na ginamit, yung mga bilang. Doon pa lang sa process ng publication, alam mo nang may vetting process na independent. Kasi hindi dahil sinubmit ng manufacturer and then the journal or whatever group is publishing it will go through their vetting process. Sa Sinovac, puro nanggagaling sa press releases nila. So may ganong question. Kaya nga hinihingi yung datos so that our own people, those who can understand the data, not just experts, there's a whole slew of people who can analyze that data. And that would make the discussion better. Diba? Hindi
Josh,
yung iipunin na lang natin sa iilan. Yes.
Yeah. So Josh, hindi enough yung nadidinig natin from media reports na okay, in Turkey, 90% efficacy. In Indonesia, it's around 65% efficacy. In Brazil, 50% efficacy, but 100% efficacy for severe COVID. And sinasabi din na yung Sinovac, it's the only vaccine na tinest sa healthcare workers. And also sinasabi din na ang dami-dami lang na bakunahan itong Sinovac, not just in China, but in other countries. So what's the problem?
Of course, the difference between the other vaccines, for example, all four vaccines, including Gamaleya, already published their phase 3 clinical trials or their preliminary analysis of those phase 3 clinical trials. But until now, Sinovac and many others, including Sinopharm as well, have not published any of these information. So that's why we are left to guess why are the numbers so wildly different? No, why is 91 so far from 65, from 50, from 100? No, they're all inconsistent. No, so that's the problem. Where is the reconciliatory data and the information on why these different trials had vastly different results? No, so that's something that has to be explained. No, now of course, number one, by the manufacturer, by those who were conducting the trials. No, the impetus is on them. No, but unfortunately, because the Food and Drug Administration did agree with the data, even if it was just using unpublished and published data, the bigger concern here is, will they properly analyze the data and provide those information in the interest of the general public? No, so that's something that we still are asking for, no? Especially with regards to the Food and Drug Administration, is that it is their responsibility not to look after the welfare of those who will be consuming these vaccines. No? And then that's the bigger question. No? So without the phase 3 clinical trial, the published phase 3 clinical trial data, how can we actually say that these information are more than just press releases, no, or more than just hypotheses, no, for example. So while we know that there is an unpublished clinical trial data, it still has to be peer reviewed, and it still has to be analyzed properly, so as to see if there are biases, if there are errors in their sampling or errors in their computations. So that is the importance of peer review, and that is something that other vaccines wanted to ensure as early as possible, so that they can submit for emergency use authorizations. No, but somehow, when it comes to these vaccines did not, or have still not done so. No, but given the political climate, given the current state of geopolitical affairs, it begs the question: why is there seemingly a facilitation or an exemption for these specific vaccines, without actually saying that there is, a conspiracy theory about these things? But we have to really ask that question: that why is there seemingly a bias? Why is there seemingly a facilitation specifically for these vaccines that have actually been donated, to the Philippines? Now all of a sudden we are facilitating the regulatory processes.
I think
Barnes?
Doc Jean wants to add
Barnes.
something.
Yeah.
Yeah, but I also want to ask
was-
Doc Jean, if you can explain to our audience na kung usual itong peer reviews for these scientific data, for vaccine development, because baka hindi naiintindihan ng audience natin.
Yeah,
Ano ba
yun yung gusto ko
ano ba tong-
idagdag actually.
Yeah, ano ba tong peer review na sinasabi ng mga doktor na to? Yeah.
Yeah, kaya gusto ko idagdag kanina, because we're looking at everything that yung lahat ng ginagawa ngayon pinabilis eh. It's all, everything's being expedited. The entire vaccine development usually takes years. Taon ang tinatakbo niyan dahil gusto mo ang tignan, you want to see every aspect, yung sa safety and efficacy. So it takes many years for a vaccine to be developed. Now we're looking at vaccines for COVID that were developed in a much shorter time. And given that short time, there's so much data that there's so many things that we still don't know. Halimbawa, hindi rin natin alam kung may protection yan sa akin, how long will that protection last? Pag sinabi nilang 95% yung protection, how long will that 95% protection last? Will that wane over several months? Or ma-maintain ba yan for let's say 6 months tapos tsaka mag-wane? Nobody knows that. Wala pang nakakaalam yan. Kaya kaya rin mapilit tayo, and that's why we insist we need to look at what is available data and interpret that available data properly. Kasi kukunti na nga lang yung data, pinabilis mo na nga, marami ka pang dapat kunin. Yung hawak mong datos, dapat sinsinin mo na. We should really look and try to understand and look at nitpick details just to make sure, because we're talking about safety and efficacy. In fact, for me, mahalaga yung safety kaysa efficacy. Kasi kung hindi naman ligtas yung isang gamot, yung isang bakuna, ba't mo siya gagamitin? Wala nang saysay yung efficacy niya.
In light of our Dingbaksha experience.
Ngayon, sa Dingbaksha experience natin, lumalabas na ang tinitignan ngayon ay yung side effects. No? Bukod doon sa binibigay niyang protection, ano pa yung side effects. Lahat ng yan kailangan pag-aralan. Ano? Tapos, yun nga the discrepancies with the numbers, yung sinasabi ni Joshua kanina, malaki yung coverage ng Sinovac, yung mga studies nila, pero malalaki rin yung discrepancy sa numbers. Tapos, meron ding pag-atras abante when they release the data. So, all of that needs to be reviewed. Kaya nga ang sinasabi, asa na yung data para mapag-aralan siya. If there is no published data, if there is no vetted data, then tell us what Sinovac is giving out, what is telling. Kasi many of us are just looking at press releases. Press release na yan ng kumpanya. So definitely it's going to look favorable for the company. So we are just kumbaga ang ginagawa natin is due diligence. The question is, ang tingin ng iba, we're just taking too much time. Kailangan nandito na yung problema, nandito na, wag tayo magtagal, ito na yung bakuna, gamitin natin. So may ganong pagtatalo. That's where the debate, the discussion comes in.
I want to ask nga actually, so our numbers are showing these last couple of days, not naman a sharp rise, but a rise. Today, we have almost 3,000 new cases. And if you look at and if you look at the number of deaths as well, parang tumataas din. So, hindi ba
ibang areas,
Yeah, so hindi ba urgent, Doc G?
The sense of urgency is always
kasi
there.
ng mga experts, ang sinabi ng experts kahapon is, well, ito yung parating you know, and we think efficacious, we think it's safe, and since ito yung parating, wala tayong choice, then let's use them. Pero I don't know if that's true now because may AstraZeneca na nga parating na nga. Yeah.
That's true. Kaya lang ang question pa rin talaga is tignan natin yung let's look at vaccines per se and vaccines in relation to our COVID response. Because the vaccines themselves don't work overnight. You have 2 doses, you have several weeks in between, right? And even if you get the 2 doses quickly, it takes a while for your immune response to mount. If it takes a while for your body to mount an immune response, ibig sabihin, kailangan pa rin ng panahon para mag-mount ka ng immune response. Pangalawa, yung rollout mismo. Kung handang-handa na yung ilang mga hospital o yung mga ibang centers dito sa Metro Manila, can we say the same outside Metro Manila? How ready are we to roll this out to places that are more difficult to reach, but at the same time would need the vaccines? So isa yung usapin. And the other thing is, let's look at vaccines and how it plays into our pandemic response. Ano ba ang papel ng bakuna? Sinasabi nating lahat, vaccines are additional protection. Of course, they're additional protection, but they're not the solution. We still have to do what we've been doing before: face masks, physical distancing. It doesn't change the fact that once we get the vaccine, are we automatically just going to remove the quarantine? Even now, the Interagency Task Force has not mentioned anything about an exit plan. So, kailangan tignan natin yun.
Hindi ba?
Binabawasan nila yung restriction. Kaya ngayon na nakakainis Hindi naman sinasabing nililift na yung quarantine, binabawasan lang yung restrictions. Yun lahat yun arbitrary Wala namang medical sense doon Ang sinasabi lang nila, kahit nakakapagtaka ka kahit ng DOH. The DOH is saying we need to revive our economy. The point really is, if the medical solutions have been put early enough, we wouldn't even be in this kind of situation in the first place. We wouldn't have to choose between our safety and the economy. The thing is, we didn't do it. Now, are we going to move on with 2021 with the same kind of thinking? Di ba? Kasi even now, we are still depending on the IATF to lift restrictions without telling us the basis of when we're actually going to be released from this quarantine. Now, the vaccine may play a part in that, but we have to really go back and say, ano ba talaga ang plano sa pandemic response natin in relation to the vaccine? I think that's a question that needs to be answered by the IATF. Yeah,
Josh, can I also get your reaction? So slowly, maybe not slowly actually, but the restrictions are being lifted already. May parating na ng mga bakuna. So, tama ba na do you feel like this is the time to lift these restrictions. But kasi at the same time, I think we lost you there kanina when I was asking Doc Jean. At the same time, pataas yung COVID numbers natin, both the cases and the deaths. And I'm hearing actually from doctors na yung mga ICU natin ay medyo napupuno ulit. Parang they're saying parang ito yung nangyayari nung July papunta sa August.
Right. So we're still going to see that, no? So right now we have about 2,600 cases, and then today we had 2,900. And so it's definitely on the upswing.
On the
And so just like before, when health workers try to warn, what is usually the response? No, it takes a while before there's actually a government response. No, so that's the thing that we've been seeing. No, as much as we want to trust our experts, sometimes the experts seem to be powerless when it comes to things that are actually political in decision making and political in nature. No, so that includes, of course, the pandemic response. No, so we are still seeing, a lot of shortcomings in testing. We're still seeing some shortcomings in quarantine and contact tracing. We still have provinces, 38 provinces at that, without testing centers. We are still at 1:7 when it comes to contact tracing. And even if there are news about the variants, we are allowing people to not be tested. We are allowing people to just quarantine imperfectly rather than actually doing proper contact tracing, proper testing, and proper isolation, in being able to facilitate these measures in order for the general public to comply. So that is something that we are still seeing, that the response has still not really followed even the opinions of the experts. So that's something that we still are calling on. And especially with the vaccine, even without the vaccine, we've already heard about those suggesting that the whole Philippines goes to MGCQ by March 1, even without meeting the already prescribed parameters. But now all of a sudden, even when the vaccines are coming, we know that the effect of the vaccines will only take into effect if we reach 60 or even 50 to 60% of our population. That's when we will start to feel those effects. So until then, we really have to still beef up our pandemic response. But unfortunately, our focus has really been on just procuring the vaccines. So right now,
but do you feel like the government is making the vaccines or looking at the vaccines as a silver bullet? Because Doc Jean has already said it's not the silver bullet, and the DOH has always said as well na kahit may bakuna na, we still have to follow the basic health protocols. Pero at the top, let's say, for example, si President Duterte, from last year hanggang ngayon, right now, he's saying, pag may vaccine, the whole nation can shift to MGCQ. So does it feel like the government as a whole is looking at the vaccine, and, next week parating yung vaccines, and, today they loosened a lot of the restrictions. So does it feel like the government is looking at these vaccines like they're a silver bullet?
Definitely. The vaccines are seen as the gateway towards reopening the economy, towards getting out of the pandemic. Even if a lot of experts, especially those in public health specifically, have mentioned that it's not really the vaccines alone that will change our health system for the better. We've seen this in many countries who have been able to control COVID-19 even without the vaccine. In those top 10 countries that were released in the Lowy Index, for example, in their COVID-19 response, that was way before any COVID-19 vaccine was being discussed. But still, they were able to bring down their cases to zero. Why? Because of better testing, because of very efficient and aggressive contact tracing up to the 4th, 5th degree. And now we're still only up to 1:7, which is basically just the household. So there really is a need for the bigger picture with regards to mitigating the pandemic. And that's something that the DOH tries to say. For example, by that we have to still continue with wearing face masks and face shields and doing the regular physical distancing, even if there is the vaccine. And that is something that is causing a lot of confusion for the people, especially when they're hearing from the government that the vaccine is seemingly the final solution. No, but if you tell them that we still have to do physical distancing, wear face mask and face shields, then people start to think then maybe the vaccines aren't the solution. No, but the real answer is something that is lost in the translation, because it's really about strengthening our healthcare system. And until our COVID-19 managers really realize that the way out is not just the vaccine, but really strengthening a healthcare system as the better normal, then even with the vaccine, then perhaps, with all the confusion that it's causing, all the alienation it's causing from the general public, it might not even be tangible, especially we're seeing now, no, with even if the government says the vaccines are coming, what are the percentages coming out, no, in the surveys? No, less than 60% are willing to take the vaccine. No? So it really poses a big problem. Mm-hmm. Yes. So it really poses a big problem in communicating.
Yeah.
So
Bart,
Doc Jean, at the rate we're going.
Let me just add something. The thing with what you asked earlier, kasi is it's very true. You have your Department of Health already saying, and almost everyone in the health sector saying, the vaccine is not the solution. It's not the silver bullet. And yet, you have your president and the people in the interagency task force saying it is the silver bullet. It is the solution. Now, kung may ganung disconnect, if there's that contradiction raises the issue of how should we proceed when those who actually know are not being listened to, and those who decide how to proceed with our pandemic response. Paano natin harapin itong COVID-19 na to ay hindi yung mga nakakaalam paano siya. In fact, if you're talking about the vaccine, the reason why nagkaroon tayo ng delay sa supply is because hindi nila alam yung mga dapat ihanda. Sinasabi na nila yun. Nahuli sila. Even yung sa COVAX facility requirement, they came out late. Now, we go back to the question, with or without the vaccine. Hindi, yung sinasabi nilang yung indemnification clause, right? That's always been around as a COVAX requirement since November. Tapos sinabi lang nung vaccine SAR natin, mid-January na. So 2 buwan yung nakalipas. Tapos, where do they get the idea that they can actually get the COVAX facility vaccines without fulfilling those requirements? In fact, as late as December 15, the Philippines was amongst those not listed in getting, not even an intent. Kasi the COVAX facility has a list of those with a commitment already and those with the list with the intent to get kahit doon sa 2 list na yun, wala ang Pilipinas. That's already December. So, November pa yung requirements nakasulat. So they really missed out on it. And I wouldn't be surprised because they're not aware of these requirements where they should be. No, ang nakakapagtaka kasi, imagine mo sa usual, kung halimbawa before the pandemic, pag may outbreak ng pagtatae, may diarrheal outbreak or may outbreak ng measles o may outbreak ng dengue, sino hinahanap? Health personnel, people from the health center, doctor, nurse, di ba? Sa maliliit. Pero ngayon, we're facing a global pandemic that's affecting the entire nation. Asan yung mga health personnel mo? Nandun sila sa tabi, taga-advise, when in fact, they should be the one leading the vaccine response. And now, we have the vaccine, the pandemic response, and now we have the vaccine. Nakikita pa rin yung disconnect. Because the people who are making the decisions are not the people who know better or who at least have everything, the bigger picture in mind. And why is it like that? We've already seen that in 1 year. And again, as I said earlier, we're in this troubling situation simply because we didn't do it early enough. If we could have done it early enough. Now, are we going to still go through that? Kaya yung sinasabi, nakakalungkot kasi magkaiba yung sinasabi ng DOH at iba yung sinasabi ng IATF. At sino yung nasusunod? usapin to ng kalusugan at ng tao, ng buhay ng tao, di ba? So,
But
doon pa lang sa punto na
are you
yon, we see something is wrong. Yeah, go ahead, sorry.
are you not seeing light at the end of the tunnel? See, President Duterte has already signed the indemnity bill. We've just learned that AstraZeneca doses are coming as well on Monday. The Philippine government has said they're willing to pay more to get the vaccines earlier to the Philippines.
Mhm.
So, I mean, are you not wala bang sense of optimism from this point on? Na, you know,
Yeah,
darating na mga vaccine.
if you're looking at are we happy that these things are happy? Definitely we're happy. But if you're talking about how it is in the bigger picture, let me just put it this way. We have a lot of symptoms, and the treatment that we're doing right now is very symptomatic. So we're happy that some of these symptoms are being addressed, but is the real underlying illness being treated? For me, that's the really problematic part. We can see hope that hey, some of the problems we've had as symptoms of our lack of real pandemic response being addressed, sure, and that should make us happy. But the fact that we're not dealing with the underlying illness, and what is that underlying illness? The mode of thinking, the way we approach the pandemic, the way we coordinate the entire Philippine government, the way government thinks, in fact, is problematic insofar as how it's dealing with the pandemic, and that is the underlying problem. Now we may nobody knows after the vaccines, baka may bagong problema na naman tayo. So it's like a person having so many symptoms. We're dealing with some of that person's symptoms, but we're not really fixing the illness that is causing that symptom. So yes, there is something to be happy about, that this patient is no longer in pain or is no longer having difficulty breathing, kung ganun pa natin i-analogy yan, ano. But are we really rooting out the illness? And that is something we really need to have to address. That's the elephant in the room right now. We are doing this very symptomatically.
Doc Josh, I think you want to add something, but I also want to ask you if healthcare workers feel the burden of boosting public confidence in vaccines. Kasi sinabi kahapon na, in order to boost public confidence in vaccines, sana, hindi naman sinabing sa pilitan, pero sana magpaturok ng Sinovac yung mga healthcare workers, and in particular mga healthcare workers sa PGH. I don't know if that's good now kasi may parating nga na AstraZeneca vaccines, pero yun yung sinabi kahapon, Doc Josh. Yeah, we lost the...
Off. Yeah, wala kang audio, Josh.
Josh, we can't hear you.
Wala kang audio.
Sige. Ayan. Ganoon na ba?
Yes.
Yes, there. Yeah.
Wala ulit.
Okay. I think it might be a connection problem. So I'll go back to you, Doc Josh.
Connection problem.
Yes. Balikan kita, Doc Josh. Doc Jean, maybe you want to answer that kasi total.
Well, yeah. Sa PGH, we're put in a spot, no? Parang pag hindi ka nagpabakuna, parang you're not doing your share in alleviating vaccine hesitancy, or at least proving confidence. On the short term, that might be true, and people might misconstrue that. But the question is, how do we really solve vaccine hesitancy? It's not getting your health workers vaccinated. That's not it. If you remember in our history, sa kasaysayan natin, kailan ba naging patok yung pagpapabakuna? Panahon niya ni Flavier, ni Dr. Juan Flavier, nung Secretary of Health siya. Patok na patok yung pagpapabakuna kasi nga pinopularize niya, 'di ba? Yung Oplan Alis disease, may patak center ka pa noon. So, alam na lahat ng tao 'yan. Now, during that period, yung vaccine discussion ba was led by experts? It wasn't. It was about getting people involved. So for me, if we really want to address vaccine hesitancy, it takes investing in in getting the people on board, in making them understand the importance. Hindi siya one-shot deal din, na pag lahat ng mga taga-PGH nagpabakuna na, okay na. Or yung mga experts mo, pag nagpabakuna na, ay, nagpabakuna na yung expert, susunod na ako dyan. It doesn't follow. There has been no study that shows that if you're experts, even if you're politicians, in fact, or yung mga artista, magpabakuna yan, it doesn't follow that it will increase vaccine confidence. In fact, people might think, privilege yan eh. Paging privilege pa yung pagpabakuna, nauna yung mga. So I think when it comes to vaccine hesitancy, we need to invest more time. And the more important thing is, get people to this is a public health issue. So kailangan talaga yung mga tao sa komunidad on board. That's the secret to having a successful vaccination program for me.
Doc Josh?
Diyan na si Josh.
Are you back?
Right. Okay, so I was saying earlier, I think the real measure really of whether we should be optimistic or pessimistic when it comes to our COVID-19 response is what are the patients saying after we give our advice. We give our advice about quarantine, about testing. More often than not, we hear people saying na hindi na sila naniniwala dyan sa COVID. We hear people saying na totoo ba talaga yung COVID? Ginagamit lang yan para kumita yung mga health workers, or some are saying na we have to learn to live with the virus, na hindi na natin mawawala yan. And I think that's reflective that we are losing in terms of trying to help the public be empowered, be empowered to defeat the virus. So what do we hear in other countries? In other countries, we hear messages of people being empowered with knowledge or being empowered with a sense na kaya ng lipunan natin talunin yung virus, rather than resorting to conspiracy theories or ideas na baka hindi naman siya totoo or denial. So I think it's reflective of the fact that nahihirapan tayo to send the real message because there's so much confusion, because there's so much distrust. And with regards to just trusting the experts, we saw that with Dingvaksha, and that's one of the biggest traumatic elements that are stopping people from being for trusting the vaccination process. And even back then in 2015, people were told to trust the experts. So did trusting the experts stop the Dingvaksha issue? Did it stop it? Did it stop people from doubting? From doubting a lot of the issues that were coming out, with the politicization of the vaccination, being tied with politics and being tied with larger vested interests. So that is still something that is existing now. So a lot of health workers feel that burden to have to exert double time. That it's not just having to explain the medical science of it, that is usually our job, but now we have to explain a bigger aspect, which is the socio-cultural aspect that is causing so much of the anxiety that people have with vaccination. It's a major burden, especially for health workers who are not at the level of the community. And that's something that is really needed.
So-called VIP vaccination, which I have to emphasize is illegal. That's not helping, is it?
Definitely, a lot of people feel that it is disconnected. The people don't feel that a vaccination program is theirs. People don't feel that the vaccination program is for them because of so many privilege that is surrounding a vaccination program. That they hear that who are those who are on top. Of course, they understand that health workers have the first access. But when they hear about politicians, when they hear about richer businessmen or just being vaccinated before them, the bigger question is, are we really part of this program? And that's something that a lot of people start to doubt. When they're not included, when they're not consulted, how can they feel that this vaccination program is really meant for them? And given all the trauma that so many people are not addressing, but just listen to us instead of listen the public is experiencing and doubting, it really leads to that disconnect, start to not own the vaccination program and therefore not feel at all empathetic to the goals of a vaccination program that our government is espousing.
Mm-hmm. Doc Jean, I want to ask you about the town hall today
Yeah,
at PG. I'm not sure if you were able to attend that.
catch it,
If you
catch it.
were,
Yeah.
if you were able to attend that, would you be able to update us on what was
I think I
discussed?
won't be in a position. I won't be in a position to update you on that because I didn't capture the entire process. I was there to start, but I had to go somewhere, and so the end. So I might not be in
Mhm.
the best position to tell you about it.
Mhm.
So sorry about that. Yeah.
Okay, but suffice to say, ang sabi ni Dr. Jonas Del Rosario earlier in the day, hindi naman ito to convince the PGH health
Well,
workers.
well, the message
Take
now
the
they're
sign of
saying is it's the message now they're saying is it's being offered. It's being offered to them. It's an option, and if you don't
Mm,
take it, then it's something that you're not going to be punished for, right? But
yeah.
what really captured my my attention was the at the end part when one of the undersecretaries of health mentioned that the health workers should really learn to appreciate or at least impressed upon us that we should appreciate the fact that they struggled very hard to get the health workers to be the priority for the vaccines. Now, can
Sorry,
you
why
imagine
would
how?
it be a struggle to get to be the priority? I
That's
mean,
right. Precisely what I thought.
sandali,
And sabi ko, sa
this
ganitong panahon,
will off.
kung kailangan nating ipaglaban pa na mauna yung mga health workers, there's something wrong with the thinking, di ba? With the thinking behind it. So it really didn't help people appreciate it because they know there's something wrong. There's a disconnect between what should be happening. Kaya ako
Sorry,
nag-react din ako. Naisip ko
as a
parang may
non-medical
mali
person,
doon,
this
ano,
is
na
unbelievable to
kailangan pa
hear.
na. Yeah. Pero malinaw 'yun eh kasi parang may appeal for health workers to do our share and to think and this is the other part that really raised my eyebrow na may appeal for us to think beyond ourselves to parang an appeal for our patriotic duty nga to help spread the concept that the vaccine is really important and by showing everyone that we can be vaccinated it sends a message that the vaccines are safe. But you're talking to PGH people. These are the people who already exerted blood, sweat, and their lives to serve, Parang ang ironic naman na sila pa ang sasabihan ng ganon. Where in fact, yung sinasabi mo nga kanina, ang dami-daming nagpabakuna na nauna. And the fact that government is, you can look at the way that you can see the way government thinks. Parang uh, vaccines have become an entitlement, a personal entitlement rather than something that we should collectively strive for. Diba? Kasi naririnig mo rin kahit sa announcements ng presidente na pumapayag sila na may mga LGUs na mauna. Mauna ka, Quezon City, mauna ka, handa ka na, Pasig, go ahead. Pero is that really helpful? I mean, sure, kung limited talaga yung vaccines, you really have to prioritize. Pero sa usapin ng pagbabakuna, ang konsepto talaga ay walang ligtas kung hindi tayo lahat ligtas. It's a matter of social solidarity. We all have to be in it on this and almost together kung kakayanin halos sabay-sabayan. Di ba? Ganun kahit yung programa ng gobyerno sa pagbabakuna, ginagawa yan sabay-sabay because you really want everybody to spread. Now, if ang thinking is kanya-kanya tayo, that doesn't help. And it's translated from that privileged perspective na kaya ko, mayaman ako, mauuna ako magpabakuna hanggang sa LGU. So nakikita mo yung thinking, hindi nagbabago. It's to each his own or to each their own and that doesn't help. It really runs contrary to the concept of vaccines being a collective effort based on social solidarity. Doon
Gosh,
nawala nawala yun sa conversation. Yeah.
is this the first
Yes.
time you're hearing this? Na struggle, they had to fight for medical workers to get priority in the vaccination program.
Yeah, that's really disappointing, no? Especially there have actually been recommendations. No? So yung World Health Organization, the Strategic Advisory Group of Experts, as early as July last year, they already released yung who should be prioritized for vaccination. No, it's a guide for countries, no, especially those countries who are still in community transmission, for countries who have no cases, and for countries who have very small amounts of cases. So the advice has always been health workers should be the first priority. No, that shouldn't even be up for debate. And now all of a sudden we're hearing this. No, but I want to emphasize as well, aside from the suggestion that health workers be first, the recommendations was that the next would be senior citizens, and then the next would be those with comorbidities or with illnesses that can worsen COVID-19, like hypertension, diabetes, and asthma. So for the first three, we're pretty much on par. No? But number four, one thing that is mentioned by the WHO is that we have to prioritize the disadvantaged, those who have long been neglected by a healthcare system, because these groups are more at risk for COVID-19 because of the way they live, because of how difficult healthcare services are for these individuals, so such as ethnic minorities, the internally displaced persons, those suffering humanitarian crises, those who do not have a proper or homeless, no? So the homeless, the ethnic minorities, the internally displaced persons. And we're seeing this in other countries being done. No, we've heard about stories in the Vatican, in Canada, where homeless people are being vaccinated, where indigenous peoples are being vaccinated in Canada and Brazil. No, but in the Philippines, we don't really see this.
So are you saying you have a problem with military
On cam ako
and
na. Hindi ko mawala yung
members of the police force
being
high up in the priority list of vaccination?
Yeah, that is what I mentioned, that by being prioritized, especially the disadvantaged groups, the WHO said, and even even our inequality shows that these people are more at risk, significantly more at risk because of their standard of living and because of their access to healthcare, in which they are more predisposed to having severe COVID-19. And we have to let these people identify with a vaccine program because it cares for them. And being in the priority list, I think, is one of the higher and better ways of really helping the marginalized groups feel that they own the vaccination program. Now, by increasing, for example, in priority the uniformed personnel, I think it just sends the message that, well, they are this administration's frontliners, in their response to COVID-19. Now, it just emphasizes the role of the police and the military in the Philippines COVID-19 response. And so that
it's not
is
just,
it's
it's not just because the Sinovac vaccines were specifically donated for the
Yeah.
Defense Department or to the Defense Department and the AFP. Etong
Yes,
600,000 kasi are donations.
Yes. Yung Sinopharm, for example, saka yung sa Sinovac, these were donations. These started out as donations, and then they were given to, of course, given their proximity to the administration, they were given, and maybe the administration was the one who decided, who would use these donations. Up to now, we still don't know. It's still kept in secrecy. So why does it have to be kept in secrecy? These are the same things that we and Doc Jean have been talking about earlier. These vaccination should be public. Vaccination should be owned by our society. And by keeping these things away from the general public, it really just sends the message that vaccination is something that is only for the privileged, something that is not a public good or a right of every individual.
All right. Overtime na pala tayo, but I just want to ask one last question to Doc Jean. So, kasi I did start with that breaking news of the AstraZeneca vaccines coming on Monday. So, gusto ko lang sanang linawin. So, dahil may parating na AstraZeneca vaccines, hindi na ba ngayon problema yung vaccination program sa PGH? Because obviously there was an uproar in the last few days because from Pfizer, naging Sinovac, and there was no sign that another brand of vaccines was coming in as another option for our healthcare workers at PGH. So now na alam na natin na sa Monday may parating na mga AstraZeneca vaccines, would this vaccination program at PGH now go smoothly next week?
Well, PGH has always been ready. They've been ready for a week, for a couple of weeks already. Dahil nag-simulation na, no? But again, the promise of all these vaccines coming in is just up for discussion until we see them. And even though there was a town hall meeting this afternoon, I think the discussion is still going on. People are still weighing their options. People are still letting the discussion sink in. And I would be remiss to interpret what they're thinking right now, because I'm sure the everything is just happening. And even though the prospects, of course, the having another vaccine coming in this Monday is a happy thought. That really you can almost hear the collective sigh of relief. You know, yung parang nakahinga ng maluwag na may option na gano'n, ano. Parang nakakatuwa yon. But again, being realists, and Josh knows that kasi dumandi sa PJ, we're not gonna celebrate until we see it. There, yung mga ganon, di ba?
Pero
at
sense from
hihintayin pa rin yun.
Pero anong
Kasi
sense from healthcare workers? They're
it gives them a real option. It gives them a real option. It gives them a real option. It gives them something to really to consider, because before it was very difficult. You're tied. You're painted to a corner, and you're in a situation where the choices are very limited. So ngayon medyo lumuwag ng konti, nagkaroon ng lugar sa pag-uusap. Tapos nakapaglinaw din talaga yung kanina yung usapan na walang sapilitan. Kasi dati parang meron pang tono na pag hindi ka nagpabakuna ngayon, mahuhuli ka. May mga ganun pa, nailinaw lahat naman yan, at maganda naman na nailinaw. Pero may mga bagay pa rin na hindi natatapos na pinag-uusapan. I think that is something that we will still see in the next couple of days, in the next coming days.
And Josh, I would assume, and correct me if I'm wrong, na yung nararamdaman ng mga healthcare workers natin sa PGH, the same din, mga healthcare workers in other hospitals.
Yeah, pretty much naman. Initially kasi, of course, a lot of hospitals were being told, no, that they were on a list. The DOH even released a list of those who are qualified to receive the Pfizer vaccine. And that really caused the increase, no? Yung increase ng so 32 That's hospitals, right. That really boosted, no, the percentage of health workers that were willing to take the vaccine. And so it's not really about brand, it's more about the data, it's more about the information that is coming out. And when all of a sudden parang they felt shortchanged, na bigla, uy, Sinovac na lang. Right. And you know the problem is that yung general statement that the government is telling people is that sige na, tanggapin niyo na yung Sinovac because it's good enough. No, pwede na yan kasi kailangan na natin ng magagawa, no, para sa ating immunity in serving our patients, that it's all that we have. No? So I guess the bigger question then talaga is, until when do our health workers, do our communities have to deal with the pwede na yan? Or no, that's making do with the treatment, making do with the healthcare system that we know can do better and that we deserve better from a health system that should really look at health as a right of every individual, at looking at health as something that is government's responsibility to ensure to every Filipino, may pandemic man o wala.
All right,
Barnes. Barnes.
Oh,
sorry. I want to just I just want to add to what Josh said. It's sad that the town hall came as an afterthought. No, and it's very reflective of how we treat health workers, whether it's in PGH or outside of PGH. That it's usually very hierarchical in hospitals, but in instances like these, communication is important, and we have to get everybody on board. You know, decisions should be consultative and inclusive. Pero yun, minsan lumalagpas yung naglalaps yung mga ganon, and naghahabol pa, no? I mean, a lot of this could have been averted if the discussions and the communications happened before the announcements, kumbaga, no? And I think it's very reflective of how we should move forward and how it's been happening before. Hindi lang sa health workers, kundi nga sa mismong taong bayan. We need to get everybody in the conversation. Not just the experts, not just the administrators, not just the leaders, but everybody, the health workers. At the end of the day, sino ba yung babakunahan? Hindi lang naman health workers, yung mamamayang Pilipino naman. So they still also need, yung kanina sinasabi ni Josh, maraming mga misconceptions, hindi malilinaw, but just having your health workers vaccinated and showing them, hey, pumayag na yung mga health workers, okay na. We still need to have that continuing conversation, patuloy na pakikipag-usap, at kasama talaga sila dun sa pag-uusap.
All right.
Thanks,
okay.
Barnes.
Yes, we're going to have to leave it there. That's all the time we have for this program, actually. Lagpas na tayo sa oras. Thank you very much, Dr.
Right.
Jean Nisperos. Thank you so much,
Thank you,
Dr.
Barnes.
Josh San Pedro, for joining us on this Saturday evening. Thank you, of course, to everyone who caught this episode of Viewpoint. Do catch us live here on Now You Know's Facebook page, Twitter, and YouTube channel every Saturday at 6 p.m. For updates on our upcoming episodes, please join our Facebook group. Just search for Viewpoint with Barnaby Lo. You can message me on Twitter. If you have comments and if you have story leads, my Twitter handle is @BarnabyChuck. Again, this has been Viewpoint. Now you know.